And welcome all of you to our 2 days workshop on wound care and its management. Before we start, I request all participants to mute your microphone, and if anybody want to talk, you can chat in the chat box or raise hand. We will put the question to the speakers. And also, if anybody want to share screen, we will allow you after you take chat directly to me, then I can allow you. And you can on your video, no problem. That is no issue. If you have no network issue, you can on your video also. So everybody can see everybody's face. But don't share the screens if not required. And today we have this event, workshop on wound care and its management with Wound Care Society Malaysia, headed by Professor Dr. Hari Krishnan. All of you know him. Nothing to introduce about himself. With me here is Datin Dr. Hafija, Professor Dr. Hafija Che Hassan. She is our Deputy Vice Chancellor Academic. And in meeting we have our Co-Chancellor, Professor Datuk Dr. Haja Bibi Florina Abdullah. Welcome, Datuk.
Welcome, Datuk.
Our Co-Chancellor, Lincoln University College.
Hi, everyone.
As you all of you know, maybe, that she is the first Nursing Board Director of Malaysia. And our President, Dr. Omia Bhomik, also joining. I think already joined, sir. And we have our speakers, Dr. Luino Thompson from Philippines. He is our first speaker after the inauguration session. Then we have our next speaker, Professor Dr. Hari Krishnan, and also Madam Dr. Kelly, Professor, and she is also from Australia, joined already in the meeting. Welcome, Madam. And I will introduce.
Hello.
Welcome, Madam. And
Thank
also
you.
we have Professor Rajmani from UK tomorrow, and Dr. Sumit Poddar from India also tomorrow, and we have another Dr. Mo from also tomorrow. So I think all of us will get some information on wound care management, a new era, and we will start planning to do something for this management with the guidance of Dr. Hari. So at first, I would request, as per our protocol, I request Dr. Idris. He is our former staff of Faculty of Science, PhD in microbiology, presently working in University of Malaya, to recite the dua. Dr. Idris, please.
Thank you. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين. الرحمن الرحيم. مالك يوم الدين. إياك نعبد وإياك نستعين. اهدنا الصراط المستقيم. صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Amen. Oh Allah, bless this gathering of knowledge for us and protect us and everyone from our members of our family and the whole world from the evil of coronavirus. نعوذ بكلمات الله التامة من شر ما خلق. We seek your protection from the evil of everything that you have been created. O Allahumma inna na'udhu bika min al-baras. O Allah, we seek refuge in you from leprosy, from insanity, from elephantiasis and the worst of diseases. Bismillah tawakkalna ala Allah. In the name of Allah, we have placed our trust in Allah. La hawla wa la quwwata illa billah. There is no might and there is no power except by you, O Allah. Allahumma fadna min bayni aydina. O Allah, protect us from our front, wa min khalfina, and from behind us. وَمِنْ أَيْمَانِنَا, and from our right and from our left, and from above us, and we seek refuge in your magnificence, from being taken unaware from beneath us. Allahumma Rabbana adil and ati anfusana taqwaha. O Allah, the Lord of mankind, do away with all the suffering from our suffering and heal us. You are the only healer, and there is no cure except that of yours. And grant us a cure from the coronavirus, which will leave no ailment behind. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا آتنا في الدنيا حسنة من لدنك رحمة إنك نعم المولى ونعم النصير والحمد لله رب العالمين.
Now I would request everybody to stand up and for the national anthem of Malaysia. Otherwise, you off your video. Please stand up for the national anthem. We're going to play. Thank you. I would now request our Pro-Chancellor, Dr. Haja Bibi Florina Abdullah, to deliver our inaugural address. Dr. please.
Thank you, Dr. Poda. Greetings to our President, Professor Dr. Amir Bomik, and our distinguished speakers, participants, ladies and gentlemen. Assalamualaikum and good morning to you all. First of all, thank you for taking an interest and participating in this very important seminar on a very important subject of wound care management, and especially at this time with the COVID-19 pandemic. Thank you, Dr. Sandip Poda from Lincoln University, and also Dr. Hari Krishnan from the Malaysia Wound Care Professionals for fixing this conference together. Around us and here in Malaysia, we are starting our second MCO at 12:01 tonight until the 26th of January. Nonetheless, life must go on, and therefore we need to adopt and adapt with such a situation, as it looks like it is going to stay for a while. It's all about personal hygiene and compliance to SOPs set by the government, basically a change of lifestyle. Well, now, this seminar is all about wound care management, and our objective is to create awareness on this very important subject and how we can network to share ideas on latest technological procedures, treatment, and the preventive aspect as well. Wound care management involves a comprehensive care plan with consideration of all factors contributing to and affecting the wound and the patient. No single discipline can meet all the needs of the patient with a wound. In healthcare setting, wound care involves multidiscipline and multi-staff like nurses, physicians, and rehabilitation personnel. Human skin wound is a major threat to public health and economy. In the US, chronic wound affect about 6.5 million patients, and it is claimed that an excess of 25 billion USD is spent on chronic wound, and the burden is growing due to increased healthcare costs, an aging population, and a sharp rise in diabetes and obesity worldwide. Likewise, in Malaysia, where you will soon hear from speakers, the Ministry of Health has protocols to address and is under the Medical Practice Division of the Ministry of Health, and with, of course, the Wound Care Association of Professionals Malaysia, the private hospitals, and other relevant agencies and NGOs complementing to this effort. The immense economic and social impact of wound in our society calls for a higher level of research resources to understand biological mechanism underlying the complexities noted in problematic wounds. Lincoln University College is heavily on research, especially collaborative research, and will organize from time to time seminar and discussions on latest management, treatment, especially in tissue re-engineering and stem cell biology, and of course, research which will represent the development of wound science. About Lincoln, we are a global player. We have positioned ourselves at number 80 in QS Asia and number 351 in Times Impact ranking on quality education. And back home here in Malaysia, we are a 5-star Setara, the second highest ranking from Ministry of Higher Education. As such, we are very much involved not only in quality delivery, but also in R&D. We have more than 400 collaborators around the world to our credit. And we have a vision, of course, of making education accessible to everyone in the world. For today, we brought in experts, all the speakers which you are going to hear for the next 2 days. And I hope that the discussion and the deliberation in these 2 days will bring wound care management to the next level. With this, I'm very happy to officially open this morning conference. And thank you, happy conferencing, and stay safe. Stay safe, my friends. Goodbye. Bye-bye.
Thank you, Dato. Thank you, Dato. I would now like to request our President, Professor Dr. Omia Bhomik sir, to deliver the welcome address and his speech. Sir, please.
Assalamu alaikum and good morning to everyone, especially our Pro-Chancellor, Professor Dato Dr. Haja Bibi Florina Abdullah, and our Deputy Vice Chancellor Academic, Professor Datin Dr. Hafiza Ali, and our Deputy Vice Chancellor for Research, Professor Sandeep Poddar, and most importantly, Dr. Hari Krishnan, who has been the anchor of this program. And this seminar is not a 2 days or just 1 month preparation. I know Dr. Hari and Professor Sandeep, both of them have been working on this project more than 1 year. And I'm very pleased that 1 year of hard work between the two important persons have brought us together to get such a wonderful benefit. I know, I'm not sure whether all of you are aware or not, Dr. Hari Krishnan and Professor Sandeep, both of them have also worked with one of the famous Austrian institution in wound care management, which very soon we will be launching postgraduate diploma in wound care, which I'm sure all of you will be benefited onto this. However, all said and done, I know our Pro-Chancellor has given statistics and so forth. Let us look at this wound care management not only in terms of a medical science, or not only in terms of when I have a wound, then I am managing, but how we can prevent not to have that wound. Perhaps I'm sure some of you will be reading some papers that how we can minimize the preventive medicine. If we can include that, we will be much more satisfactory, the institution and the seminar, that how we can educate our society, educate our patients that not to have wound. And what I have noticed, I mean, I have gone through many kinds of falls, even fracture, and traveled on wheelchair, traveled on crutches, and so forth. What I have experienced within myself, it is how strong my mind is. How strong my mind is. At the beginning of my any kind of injury, of leg injury, I have my fractured and so forth, various kinds of wound. But I used to be depressed. I used to be very much frustrated. Oh, I can't do anything. But what I did in the beginning of any kind of disease, wound, or whatever, I increased my prayer and meditation and make my mind more stronger, make my mind more positive thinking. And as I continued to inculcate, continue to train my mind that positive thinking. And how I did positive thinking is nothing but conviction, nothing but continuously discriminate between the body and life. And the more I did that, and more I got benefit, even the wound, even if I had gone through serious, but managed to come out, and I'm still walking strong. So my humble suggestion to the management of this very important seminar and the speakers, please try to incorporate. I know all of you will be speaking on scientific basis, and I know all of you are expert in it, but try to incorporate in your scientific management how we can have preventive medicine, not to have wound and etc. That will be a fantastic, and we will be able to achieve, especially during this COVID. I know what do you call, the government announced for 2 weeks, but today I have received many kinds of information. I'm yet to confirm. Apparently, our King has announced that MCO will continue until August 1. August 1. I did circulate amongst our management that particular notice. If August 1, it continued to MCO, So we are looking at wound, not only physical wound, we are looking at wound in terms of our survival, because lots of people will be out of business, lots of people don't have job, salary, and etc. How we can do that? That is another kind of social wound. Perhaps some of you can talk with this. But however, all said and done, let's pray together. This world pandemic doesn't harm us. Though if it is true that MCO will continue until August 1, and this is going to be a difficult, challenging time, August 1, but let's team up together as fantastic human citizen of the world and continue to pray that the wound of COVID, how we can heal ourselves and continue to work for the human society. Once again, I thank you all, especially the management of this very important seminar, and I'm sure all of us will learn wonderful scientific, non-scientific, traditional type of wound care management. Thank you once again. May God continue to bless all of us with our choicest prayers. Thank you and God bless.
Thank you, sir, for your words
Encouraging.
and interest is our initiative for you, sir. It is possible to move forward with the new scenario and new programs on postgraduate diploma in wound care management with Dr. Hari. With the support of all of the participants, we will move forward for sure. And sir, with your idea, I just want to share that I just want to share that we have proposed one book on edited book on human resource and mental health, a psychosocial management. So this one just we are opening for book chapter, and this will be a very means as you told that our mental health and social responsibility in the mental side that will be covered by that book, sir. So without wasting my time, I would now like to Professor Dr. Hari Krishna, sir, President of Malaysian Biotherapy Society, founding President of Malaysian Society of Wound Care Professionals, Chairman of Pressure Injury Prevention Committee, and also National Advisory Primary Health Ministry of Malaysia. And all of you know him very well. I don't have to introduce his total biography, then whole conference workshop will go on that. So, sir, you please brief, your stage is yours, sir, now.
Let's give him a clap, Dr. Poddar.
Thank you very much, Prof. Amir, Dr. Sandeep, Datin Hafiza, and Dr. Bibi Florina. Okay, can you hear me now?
We can hear you, but we cannot see your photo, Dr. Poddar.
Yeah.
Okay, now, okay, sir. Sound, sir, speak. Hari, sir, speak.
Dr. Harry, can you speak
Yeah.
now?
Can you hear me?
Speak louder, please.
Ah, speaking. Can you hear me?
Yes.
Can you hear me now?
Yes.
Yeah.
Yes. Ah, okay. Good. Handsome gentleman.
Thanks. Okay. Sorry, what do you call this? The computers in HKL suddenly went blank. So I have to use the handphone, that's why. So now the IT is actually checking. Now, the thing is, I would like to thank Lincoln University College, especially Prof. Amia, and then what we call it, Dato Bibi Florina and Datin Hafiza and Dr. Sandeep for helping us basically for wound management. It's actually very close to our hearts, and it's actually a very big program in Malaysia now. The thing is, what we have doing now is we have also connected with the Institute of Health Management and Sigmund Freud University in Austria, who will help together with Lincoln University College to actually come out with the postgrad diploma. Now, the postgrad diploma in wound management for the 1.5 years will be submitted to the Ministry of Higher Education and also MQA and get it approved. So this will make Lincoln University College the first university in Malaysia to offer wound care program. So a great thank you to you all. It's a great achievement. And hopefully after this, all the students who have done certificate in clinical wound care, those who have done degrees in post-basic and all that can actually follow up by doing the postgrad diploma. Interestingly, quite a number of people have actually asked to join this particular program. At the same time, also this webinar series is something that we planned for a long time. And the interesting part is this webinar series together with the society and Lincoln University will have about 6 distinguished speakers from 6 countries. So basically we'll have people from Malaysia, Korea, Australia, Philippines, UK, and India. So this 2 days webinar will be the beginning of a series of webinars which we organize with all the international faculty. We have about 12 fellows in the College of Wound Care Specialists who will be involved in this talks along the way. So what we will do is we will try to involve the World Union of Wounding Societies and also the Asian Wound Care Association together with the ASEAN Wound Council. So we have more coverage in all the series that we are doing for this year. The plan is hopefully what you call this every month, or we'll try to get this kind of sessions so more people can join. Now, just to inform you, for these 2 days, during the MCO period, all of us have to embrace the new norm, which will be online management. Now, online basically will be lectures and all that, and hopefully during this 2 days, you'll be able to have question and answer sessions where you can ask the experts, basically regarding the management in terms of their expertise, in terms of their knowledge, their acumen, the perception, the practice, which is important. Now, Malaysia is not far behind any of the other countries. So what we have got some of the best advanced products in the world. So we have most of the dressings coming in, all that. We have budgets. Now, interestingly, last year we managed to get budgets for the hospitals, government hospitals, and also for the health clinics. Now, these health clinics and all that will be about 425 of them have been wound care trained. So after this, another what do you call that? One more clinic per PKD. So we should have about 500 over what do you call that? Clinics to be trained, whereby wound management will be a big aspect. Now the thing is, when you look at wound management, we're not talking just about diabetic foot problems, but also venous ulceration, pressure injuries, basically any types of traumatic wounds, acute wounds, burns, basically surgical wounds. So all kinds of wounds. But the important aspect is you need to know how to look after complex wounds. Now, this is another misnomer whereby complex wound can be called even hard to heal wounds and everything. All right. And in this particular session is the first session that I'm happy to inform you, because one of you asked a question about the budget for the hospitals. The 5.5 million which we got for last year is also will be given for this year. Now the warrants have reached JKN Selangor and also what they call is Hospital Kuala Lumpur and all that. And other hospitals also will be getting it. So just have to check on it. It will go to the pharmacy division as usual. And most of the budget for this year will go to JKN and trickle down to the hospitals. So no need to worry about that. Money is there. Number two, what they call this is for the health side. The money has been increased so to cover more clinics. So this is just to say that, you know, you have got the products and all that, but now you must basically know how to manage it well. Make sure you manage it well for your patients. So that practicality and that expert opinion you will get as you follow the series along the next what do you call this few months. Now today what do you call this, we will have a talk on diabetic foot and wound care, the new era, new beginning. Dr. Luinio S. Tongson is a general surgeon and is looking after the James D. Diabetic Foot Center. He's also a hyperbaric physician. So that will be the first lecture. Please ask him as much. He's also the president of the Philippine Wound Care Society. Next, I will give a topic on topical oxygen therapy in chronic wound management, because we have got hyperbaric centers around, but this will cover topical in terms of different types of oxygen therapies and all that. So that's also available in Malaysia. And then surgical wound complications, assessment, and principles of acute wound management will be done by Dr. Sandy Hodgetts. She's actually a researcher and head of the Skin Integrity Center in Perth, Australia. One of the plans is basically also to get University of Western Australia to be affiliated to Lincoln University College later on. So at least we have more programs along the one. I think I've spoken about this to Dr. Sandeep. So one by one, we add on more, what they call this thing. So we can do most of these things online and also practical sessions in Malaysia itself. So at least this will be a hub for the whole of ASEAN and the Asian Center itself for those people who want to actually increase their knowledge in wound management. Now, tomorrow we have got a lecture on diabetic foot involving microsurgery and lower limb extremities with Prof. J.P. Hong. And there's also a lecture on wound care animal bite wounds by Dr. Sumit Poddar from India, who is one of the foremost specialists in rabies wounds and all that. And following that, there is the management of venous ulcers, keep it simple. Now, this is actually by Prof. Rajmani, who is actually the angiologist in the University of Southampton, and he's also a visiting professor in China. So you have got big group of people in different specialties. So you have got what they call this people who are in wound care, plastic surgeons, angiologists, researchers, and general surgeons will giving you the lecture for the next 2 days. Now, one of these things is I also wanted to mention, I think Dr. Pearl has also mentioned that GPs, pharmacies, and also medical assistants and nurses are actually doing a lot of programs for wound management. And interestingly, even what they call this, the society now with Hasana Foundation is also doing home nursing for free for poor patients for the B40 group and all that. And we've been doing it for the past 7 months. So this is also good. This actually is something close to Datin Hafiza's heart, looking at what they call this, the nursing side. We must not, what they call this, forget about our wonderful nurses. Dato' Bibi Florina also was the director of nursing for Ministry of Health many years ago. So the thing is, nurses have to be empowered. So these courses basically on and off will help in terms of empowering the nurses so they can manage, number one, in wound centers, number two, basically at home nursing. So we can bring and manage the patients well in the comfort of their own homes. And now, especially if you look at the COVID session now, in Italy, what has happened is most of the patients are at home. So the nurses and the paramedics actually end up at their homes managing these wounds. We only bring in those cases which are triaged and supposed to be triaged red and all that, or even yellow, we bring them in. Green cases are kept at home. So this is something that the Diabetic Foot Society of India, together with King's College, have come out with guidelines where they look at this COVID session. That's why what they call is Dr. Lewin will also touch what they're doing during this COVID pandemic itself. So it's important to empower all the stakeholders. Now, even pharmacists are actually doing wound management. So it's good also that the faculty of pharmacy, the faculty of nursing, and the faculty of medicine, all three of them basically start joining these courses. And they've been joining quite a number of courses all over. Interestingly, the Malaysian Pharmaceutical Society also has done courses with wound management together with the community business pharmacies. So it's a huge big thing. This is just the starting, and I would like to thank Lincoln University for helping, because this makes Lincoln University College the first university in Malaysia to actually have a wound care program, which means wound care training, and now the next will be the postgraduate diploma in wound management. I hope you'll enjoy these 2 days of this, and with that, thank you very much. Back to you, Dr. Sandeep.
Thank you, Dr. Hari. And thank you all the participants, including our deputy dean from clinical campus, Professor Hamui, and all respected delegates who joined. We just request all of you to on the camera so that we can take a group photo. Dr. Lewin, welcome. So our next session will start at 12 noon sharp, means after just 1 hour. we'll start our lecture series with Professor Dr. Lewin. Dr. Lewin already joined. Sir? Hey, unmute.
Good morning, everyone.
Ah,
So Dr. Lewin will speak on diabetic foot and wound care, new era, new beginning. So we will listen from Dr. Lewin after 1 hour, and just everybody on camera so that we can take a photo and go for a break. No, no. It's good. Now next ready, next screen going to thank you. I'll send you the photos later on. And now we can give a break and we will attend with the same link. Is it okay, Dr. Lewin?
Yes, sir. I'm okay.
So after 1 hour, we start lecture. Around.
Okay.
Okay, thank you.
thank
Thank you, all of
you.
you.
Thank you, all of you.
Stay safe.
See you, Louis.
Stay safe.
Off for a minute.